Here's another very famous study, which many of you may be familiar with, done by Kevin Shulman some years ago. But it was one of the first studies that began to shine a light on the role of race and gender in the clinical encounter, and the way that women and patients of color could be disadvantaged simply because of who they are. Shulman and his colleagues recruited actors. And as you can see, these actors are all wearing hospital gowns. They're being videotaped in what looks like a clinical setting. You see on the top left a white woman about 55 years of age. Below her, a white woman about 75 years of age. In the top right, a white man about 55, and below him, a white man about 75. And they're all actors presenting symptoms of coronary disease. They said, "Doc, I have a pain in the left side of my chest. It radiates down my arm." Other stress test data were presented, strongly indicative of the presence of coronary disease. These are patients that needed to receive cardiac catheterization. If you're a physician looking at these actors and actresses, and hopefully they all did an equally good job of presenting coronary disease as they're being videotaped here. And in fact, most of the physicians tended to agree. About 90% of the physicians said, yes, these patients need to receive catheterization to determine the extent of blockage that they may be suffering from. Another set of actors and actresses also presented the very same symptoms. They're also filmed in the very same hospital gowns in the same clinical setting. Here we have what appears to be an African-American woman about 55 on the top left. Below her, an African-American woman about 75. Top right, an African-American man about 55, and below him, an African-American man about 75. So what happened here? In about 70% of the cases, only 70% of the cases, did physicians recommend these African-American women for catheterization. The men were more likely to be recommended for catheterization, but not at the same rates as white men. So there is both a gender and a race difference, even though these actors and actresses are presenting the exact same clinical symptoms. Shulman and colleagues speculated that biases and stereotypes on the basis of race and gender may have played a role here.